First, I want to talk about why this should be important to you. These regs from 2009, which shouldn't even be considered new at this point. They're pretty old news, actually. They're still tripping people up. Dreama was just mentioning to me one of her centers in her area just recently had a survey and didn't fare so well. So I know that it's still an issue. Secondarily, we know that healthcare reform, we're going to futuristically be paid by the quality of what we provide. And several of the speakers are going to touch on that a little bit more throughout their sessions. Then, of course, your marketing, your reputation, stabilization of your volume. I'm sure many of you realize or heard about the Chicago Trib that listed 20 Illinois centers, I think it was 2022 Illinois centers by name, by citation in their newspaper. Not too cool. A lot of places aren't doing that, thank heavens, because that can get pretty old. And then last but not least, because it's the right thing to do. As clinicians, we need to be able to look out for our patients and for our surgeons. This is really, really important. You hear these crazy stories all over. Just recently, the USC University shutting down their kidney transplant because they just this month transplanted the wrong kidney into somebody. Here in St. Louis, the VA, they've closed down their ORs because of some suspicious-looking instruments. So this stuff is all over, and I think we just need to be aware and open our eyes. For those of you that are working at facilities that are freestanding, this is maybe going to be a little bit of a paradigm shift for you, because we need to start thinking about our patients not as a one-time encounter. We need to think of them as people that are out there in the world, and we're affecting them in some way. And to that end, what I want to do is I want to go through a quick little case study here. We're talking here about a 56-year-old white male who presents with right-sided medial loss of vision due to vitreomacular traction from an epiretinal membrane. Basically what happened here is there was a vitrectomy with a membrane peeling of the right eye. They used local anesthesia, betadine prep, vancomycin injection during the procedure, and then atropine ointment in a patch. This is a very healthy young, well, in my mind, young man. Work with me here. Just to give you a little sense of the timeline here, and this is very recent. This surgery occurred in January. His surgery ended at 4:21. By 9 a.m. in the morning, he had improved vision. It was just awesome. By 6 p.m., pain started. 7 p.m., the pain was increasing. 10 o'clock, just a little bit more than 24 hours later, this gentleman was on a pain scale of 10, and his vision was gone. The resulting diagnosis. The treatment was some intravitreous topical and IV antibiotics, became very, very ill. Diagnosis, endophthalmitis, cultures, Clostridium perfringens, diagnosis at discharge, right eye blindness. Again, this is a person that went in for a simple procedure. This is what he looks like today, 60 days post-op. Sorry for those of you that don't do eyes, because I know a lot of nurses don't do eyes. So we have to ask ourselves some questions here. When we get down to the skinny here, we've got a couple of different things to investigate. The androgynous, those things that would have been part of the host, we know that that wasn't the case in this particular patient. And then let me just skip down here quickly to the traumatic endophthalmitis. We also know that that wasn't the case for this particular patient either. There wasn't a traumatic injury, there wasn't a foreign body, et cetera, et cetera. So that makes us that we need to look at the androgynous endophthalmitis. This is a situation where did this originate? It had to come from someplace outside, and at this point, obviously everybody's doing one of these things. So you need to work on your investigation in that situation. And the questions you need to ask yourself, is there anything that could have been done differently that would have altered this life-changing event for this patient? Surgical scrub, housekeeping, laundry services, sterilization. This is the kind of stuff you have to investigate. This particular facility's investigation, well, they said none of the nurses were sick. The surgeon was well. The case before and the case after did great. So, we can't explain why this happened. You're going to need to be looking for ways to investigate. I want to know what type of linens were used. I want to know what was there flashing going on. I want to know what that sterilization load looked like. These things are going to happen, and I think that we just need to be prepared to investigate and move forward, and that's why so much of this is important. Again, for those of you that are in those freestanding centers and you see this patient one time and you don't incur them again, you know, sometimes it's out of sight, out of mind, but we need to start looking at things deeper and dig a little deeper. I can tell you for sure this surgeon had a little bit of palpitations that next week when he went to do his next vitrectomy. And for those of us family members, this is my brother, these things last forever. So it's important.